Assalamualaikum students, welcome to my channel. In this video, I would be discussing the crown and root of the tooth. So let's start our topic. Okay, so here we have a picture of tooth. This is the crown portion of the tooth. This is the root portion of the tooth. Here we have the cervical line. This is also called as Cemento enamel junction. As the crown is covered by enamel and cementum is covering the root, so the point at which they meet or join or their point of junction is termed as Cemento enamel junction. There are basically four types of tissues in a tooth. First is the hard tissue, second one is also hard, and third one is also a hard one, and fourth one is a soft vascular tissue which is termed as pulp of the tooth. The first three hard are called as enamel, cementum and dentin. For brief description about all these four tissues, I will discuss it one by one. So first let's see what is enamel. Enamel is the most mineralized tissue of the body, which forms a very hard, thin and translucent layer of calcified tissue which will covering the entire anatomic crown of the tooth. The second tissue is the cementum, which is a specialized calcified substance covering the root of the tooth. The third one is the dentin, which is also calcified tissue and making major bulk of the teeth. It is covered by enamel on the crown portion and by cementum on the root portion, and it is surrounding the entire pulp. Pulp is the most vital part of the tissue. It is soft tissue and consisting of blood vessels, connective tissue and nerves. Basically, we call it as pulp cavity. It is divided into pulp chamber and pulp canal. The pulp which is present in the crown portion will be termed as pulp chamber, and those which is present in the root is termed as pulp canal. Here we have a picture of tooth showing a cross section. This is the enamel of the tooth. This is the cemento enamel junction, the point at which the cementum and enamel are joining. This brown portion is the cementum of the tooth which is covering the roots. Here we have the dentin, which is covering the whole pulp and is surrounded by enamel in the crown portion and by cementum in the root portion. This is the pulp cavity. It is divided into two parts, that is the pulp chamber which is in the crown portion and pulp canal in the root portions. So we have different forms of roots in different tooths. Let's discuss roots of the teeth in brief detail. Usually in anterior teeth there is only one root will be seen. Anterior teeth are incisors and canines, but in posterior teeth there will be bifurcation, meaning the root will be divided into two extensions, and in some tooth will be having trifurcations found, which means the root is divided into three extensions. As you can see, this is the anterior tooth having single root, and the rest three are posterior teeth. These two are bifurcated and this one is trifurcated, means having three roots. Anatomic crown. Anatomical crown is actually that part of the tooth which is covered by enamel as a whole up to the cemento enamel junction. While if we see a clinical crown is the only portion of the crown which is visible in the oral cavity. Gingiva, or can say gums, but gingiva is more appropriate term to use, so gingiva is covering the neck of the crown, so that portion is not visible. The portion which is visible in the oral cavity is called as a clinical crown. As you can see in this picture, from this point up to the cemento enamel junction, this is our anatomical crown. And the crown which is only visible in the oral cavity is termed as clinical crown. From the neck of the tooth, it is covered by gingiva, so it is not visible. It cannot be seen in the oral cavity as it is covered by gums or gingiva. So in this picture you can see this is the clinical crown which is visible in the oral cavity, and from the neck up till the crown it is the anatomical crown. The neck portion is covered by gums, so it is not visible in the oral cavity. Surfaces and ridges. If we talk about anterior teeth, which includes our incisors and canines, they would be having 4 surfaces and 1 ridge. If we look at premolars and molars, that are our posterior teeth, they will be having 5 surfaces. This is very important BCQ or Viva question, that how many surfaces a tooth have. So in anterior we have 4 surfaces and 1 ridge, and in posteriors, that includes premolars and molars, will be having 5 surfaces in total. The surface and ridge will be named according to their positions and the uses. So let's see how to name them. So here we go. First we have the facial surface. In anterior teeth, that is in incisors and canines, or can say from canine to canine, the surface which is facing the lip portion, that is towards the lips, is called as the labial surface. In posteriors, means in premolars and molars, the surface which is facing the buccal portion, or can say the cheek part, is called as the buccal surface. There is a collective term, that is facial surface, used when calling it in general. But if we are talking specifically, then for anteriors, that means for incisors and canines, it will be called as the labial surface, and for posterior teeth, that would include premolars and molars, it will be called as the buccal surface. In this picture you can see these are our anterior teeth from canine to canine. This surface that is facing towards the lips will be called as the labial surface, and these are our posterior teeth which is facing the buccal, or can say cheek part. This surface will be called as the buccal surface. But if we will talk in general, then this whole will be called as the facial surface. So lingual surface, all the surfaces that are facing towards the tongue is called as lingual surface. In general, we use the term lingual surface, but if we are specifically talking about the maxilla, then the term palatal surface can also be used to refer the upper jaw tooth, right? But in general, we will call it as lingual surface, that is facing towards the lip, towards the tongue, that is towards the tongue, right? As you can see, this is our mandible, the floor of the mouth at which our tongue rests. This is the lingual surface which is facing towards the tongue. This is the lingual surface which is facing towards the tongue. Now, occlusion surface. If we talk about posteriors, so the surface that comes in contact with those of the opposite jaw during the closure of the jaw, during clenching of the teeth, are called as occlusal surface. But in incisors and canines, we will call it as incisal surface. This is the occlusal surface which will come in contact when the jaws are closed. This is the incisal surface in anteriors. So now we have the proximal surfaces. Okay, as you can see, here is a median vertical line. This line is drawn vertically. through the center of face and passing between the central incisors at their point of contact. As you can see, this is their point of contact in both maxilla and in the mandible. Okay, now the surface which would be towards the median line, this median vertical line, we will call it as mesial surface, and those surfaces that are away or can say distant from the median line are called as the distal surface. In whole arch, only 4 teeth have mesial surfaces that are contacting each other, the maxillary and mandibular central incisors. But in rest of the teeth, mesial surfaces of one tooth is in contact with the distal surface of another tooth. There are contact areas that touches its neighboring tooth on mesial and distal surfaces. As you can see here, we have the median vertical line dividing the arch into right and left halves, right? This is the mesial surface of the central incisor. This is the mesial surface of the central incisors which are in contact with each other. Same is the case in the mandible also. These are the mesial surfaces of the mandibular central incisors that will come in contact with the mesial surface of the central incisor of right side and left side, right? This is the distal surface of the central incisor. This is the distal surface of the central incisor. It will come in contact with the mesial surface of the lateral incisor. This distal surface of central incisor will come in contact with the mesial surface of the lateral incisor. Then this is the distal surface of the lateral incisor. It will come in contact with the mesial surface of the canine. So